Friends, I'm going to introduce you an interesting innovative device developed at IIT Hyderabad by a team of two fellows of Center for Healthcare Entrepreneurship, Akita and Prasad, who have done this work under the leadership of Professor Renu John, where they have tried to address the issue related to neonatal jaundice. Many of you are aware that a large number of babies are born with neonatal jaundice. This problem is causing trouble to a large number of parents, both within India and in the whole world at large. In India itself, almost 6.7 million babies are born with neonatal jaundice, and in the world I have come to know that almost 42 million babies are born with this problem. And this particular device, which is called nLite360, which is developed by this team of workers from a startup called HIMAC, which has been incubated at IIT Hyderabad. And the main innovativeness of this particular product is it detects the condition of the baby automatically and adjusts the direction and the angle of the light falling on the baby, so that the required dosage of the light that is needed to handle the problem is provided to the baby, so that the baby is brought out of this problem at the earliest, and at the same time ensuring that the mother and the baby are not separated from each other and they are together, and that way this particular device is very innovative, and a large number of doctors and parents have found this device to be extremely useful for them, and I am sure that this will be a major game changer in treating the neonatal jaundice all over the world. Thank you very much.
So nLite360 is one of the devices that come from IIT Hyderabad Center for Healthcare Entrepreneurship in 2018. Prasad is a designer, and Akita Kalluju is a biomedical engineer who formed this team of HIMAC Private Limited. So they found that the basic problem with rural healthcare is one of the basic problems is that there is a lot of neonatal deaths because of the neonatal jaundice, and they looked at this problem, how we can solve neonatal jaundice, and come up with an interesting design solution of how we can do an effective phototherapy to address this problem. Prasad and Akita started their journey in 2017 with the Center for Healthcare Entrepreneurship at IIT Hyderabad.
I am Prasad Muddam, and she is my co-founder Akita Kalluju. We both are from HIMAC Healthcare Private Limited. We are designing and developing world's first intelligent phototherapy device, which provides a customized treatment for the neonatal jaundice babies.
We have a unique approach of treating the neonatal jaundice. The device is capable of treating mild, moderate and severe jaundice conditions. With this, we are able to reduce the blood transfusion cases in the babies. The device is multi-planar, which will have 360 degrees projection of light and which is covering the maximum body surface area. With this, we are able to reduce up to 30 to 55% of the total treatment time. The device is portable enough to treat the baby at the mother's side. One of the light unit is modular, which can be unplugged, and it can be connected to a battery pack and give the treatment even while breastfeeding. With this, we are promoting zero separation between the mother and child.
Globally, 42 million babies are suffering from compromised phototherapy, which is leading to morbidity and mortality. The current phototherapy devices are not suitable for the dynamic conditions of jaundice. Hence, doctors are adapting to the indigenous methods with compromised treatment. nLite360 is a smart phototherapy which provides customized and optimum amount of treatment dosage to the baby as per its conditions. The semi-automated version requires user inputs like bilirubin level and gestational age of a baby. The device is also designed to run on a battery, which enables to treat the baby in resource-constrained settings and also provide home phototherapy adapting to the post-pandemic conditions. It converts from standalone mode to portable mode, which promotes uninterrupted treatment while breastfeeding and kangaroo mother care.
we see that baby is not comfortable keeping the baby on phototherapy because they keep on crying. That time we feel like better we have one which where the mother can feed the baby and give phototherapy. We should have a device so that mother feeding doesn't get disrupted.
This is a tertiary care unit. We have a lot of babies. Apart from the inborn babies, we have even the outborn babies. So the load is very much. Okay, so we are depending on the units. Like we have very less number of phototherapy units. So sometimes we have to put 2 or 3 babies in a single unit. So something like this innovation could be very helpful for this center. Having cesarean section, she'll be in the 4th floor, and that mother can't come down to put the baby over here. Like if we have a unit like this, so that can be kept near the mother's side, and that will be really helpful for that mother and the baby also.
The device actually having almost like triple surface phototherapy, LED phototherapy, so there is less heating of the baby, less dehydration of the baby. The level of irradiance can also reduce the jaundice faster in cases of where the bilirubin is almost like severe jaundice. This way, this will be the ideal mode for babies with RH isoimmunization or with AB1 compatibility, or where jaundices are reaching very high levels and there can be kernicterus, that is brain damage to the very high bilirubin levels, can be prevented by this machine. And so not only for the life of the baby, so for a normal neurodevelopment and also prevention of the exchange transfusion. So the baby's exposure to unknown blood is also reduced. So this is an excellent device even in those terms. Reduction of exchange transfusions and reduction in kernicterus by actually modulating and giving the irradiance as per the need will be the highlight of this device.
Right now we are at a testing phase. As our company is a medical device company, we have to follow safety standards of ISO 13485. We have applied for NOC from CDCSCO and a permission from the ethical committee from our partners hospital to do a controlled clinical trials. However, we have followed all the safety standards required for our product. We are designing various other products based on our principle of zero separation between mother and the baby.
nLite360 has already crossed much of the regulatory hurdles, and they would be entering into the market within an year. So they have got certifications as from the regulatory aspect, so they should be good to go to the market in the coming year.